Now moving to the next test, and this is what is known as a Gaenslen test. The Gaenslen test. Okay, sorry, I'm just trying to plug something here. Yeah, I've plugged it. So look at this test, how it is done, and reasons why you actually need to do this test. So for the Gaenslen test, these pictures speak the loudest. So this is how it is done. So the next thing now, you actually want to know the reasons why it is done. So just so you know, it's a clinical maneuver and it's used to help diagnose sacroiliac joint issues. Yes. So if I'm able to strain you like this, if there's any pain around the hip, at least it should show up. Okay, so as it performed, the patient is lying supine, so they are facing up near the edge of the examination table. So one leg is allowed to hang at the edge. Do you understand? One leg is down. Okay, then what next? The other leg is now pulled back towards the patient. So if the examiner applies pressure to both legs, pushing the hanging leg downward while flexing the opposite leg, so the maneuver, of course, is to stretch out the joints. Any issues there will not be able to hide anymore. The issue will just be forced to show up. Do you understand? So interpretation: positive test just simply means there's pain there and shows that there's an issue in the sacroiliac joint. While negative issue, there will be no pain, there will be no discomfort, shows that there's no problem at the sacroiliac joint. So clinical use, you can use this to now differentiate between sacroiliac joint pain and also lumbar spine pain. Then you do this alongside other tests like the Faber test and also the compression test. So it's commonly used to diagnose issues like low back pain, and also you are suspecting that there's sacroiliitis or probably what ankylosing spondylitis. Okay, so this is what we have for Gaenslen.